Hi there, are you or someone you know suffering with frozen shoulder and you're wondering what is frozen shoulder? Well, my name is Huang with Hands-On Therapy Services, and if you are new to our channel here, we help people in the Miami area with hand and shoulder problems to be able to be more active, pain-free, and avoid things like having to take pills all the time, getting injections, and of course avoiding surgery. So if you or someone you know suffering from frozen shoulder, well, I'm going to tell you a little bit more about the two types of frozen shoulder. Yes, there's two types of frozen shoulders. I'm going to explain a little bit more about what it is and why it happens and who does it happen to. So frozen shoulder it can happen two ways. There's the first one is you'll hear people say frozen shoulder, and if it just happened out of nowhere and literally you had no pain from one day and the next day you had excruciating amount of pain and just radiating all the way up and down, you just can't get any relief, and you can't lift up your arm because it hurts. And the biggest one that we're always looking for as a therapist is we're looking to see how far out to the side it can happen. So that type of frozen shoulder where just from one day to the next day, you didn't fall, you didn't hurt yourself, nothing happened, and you woke up and you did all this stuff, and you tried to do some stretches on your own, put some heat, put some ice, doing all this stuff, and nothing's really helping, that is actually can be considered an adhesive capsulitis. So frozen shoulder is just another word for adhesive capsulitis, but adhesive capsulitis sort of happens out of nowhere, and you have this huge amount of pain. And there's several phases to adhesive capsulitis where you are in this really painful frozen state, and then you thaw out, and it can take up to a year and a half to thaw out. And then you can come into the recovery mode where you start to regain your motion and your strength. And that generally happens to women more than men. I know, why do things always happen to women more than men? It drives me crazy, but it does. It happens to women more than men, though I have seen it on men. It tends to happen to your non-dominant arm, and it tends to happen to women in their 40s and in their 50s, and tends to be around like hormonal changes. So that's adhesive capsulitis, which is also known as frozen shoulder. Now, the other type of frozen shoulder is something that people say because maybe you injured yourself, right? And then you stopped moving your arm and then it got stuck. Maybe you had surgery and you were in so much pain you really couldn't move it. It was very difficult for you to start moving. You didn't get the right kind of help, and so then you got stuck. That is a type of frozen shoulder as well. So if you're someone who's having some shoulder pain, then like this video and click subscribe, because I'm constantly putting out new videos and things about what you can do to get started to make sure you get rid of that painful shoulder so it doesn't become a frozen shoulder. So in the link below, I'm going to include the guide that you can grab right from our website, handsots.com, and get that free guide to give you a little head start in terms of your shoulder pain and what you can do to make sure you don't get stuck. So when you have frozen shoulder and it started as maybe just some achy shoulder pain. This happened to my mom actually. She sort of heard it. She doesn't really remember when she heard it, but she was lifting something, grabbing something, putting something away, and she kind of felt like this tug, pull. It hurt, but then it went away. And slowly but surely, she sort of stopped using her arm, not necessarily always like consciously not using it, but she stopped using her arm to let it rest, and then she let it rest, and then when she went to try to really move her arm, it got really painful, so then she would stop moving it, she would stop and let it rest. Over a period of time, it got stuck. So at first, maybe she was able to lift it a little bit higher, but then over time, she couldn't lift it high enough. Now, I see my mom every weekend. She never mentioned it. She didn't tell me she had shoulder pain until one day her arm was just stuck. She just couldn't move. It was so painful, and then she got help. Now, I don't want this to happen to you. I want you to get the help before this happens. And so that's what frozen shoulder can be, and people use those words pretty loosely. If you are somebody who's suffering from shoulder pain, it doesn't really matter what the diagnosis is, right? You have shoulder pain and you can't move it. You can't bring it up. You can't bring it out to the side. And the worst thing is, like, you can't get back here to make your ponytail, to fix your bra strap, that kind of stuff. Like, bring your hand back and pull your shirt down, little things like that. Your shoulder starts to get really painful and get really stuck, and you've lost motion. That's frozen shoulder. And if you are somebody who's suffering from whether it be just a little bit of shoulder pain, you're starting to feel a lot more shoulder pain, starting to be consistent, or you're stuck, we can help you here at Hands-On Therapy Services get started to make sure you're clear in terms of what's going on with your shoulder and what's going on with your shoulder pain, and help you to decide what's the right help that you need so that you can get rid of it. One of my things that I really am trying to do is, I know that people have aches and pains and they get stuck, and then they don't do anything until they get the frozen shoulder. And when they're stuck and in pain, it's so much harder to treat. So if you're somebody who's suffering, no matter what stage you're in, we are going to put the link, I'm going to put the link in the description, so you can go to our website and grab our free guide. It's going to have some tips on what you can do and some tips on what not to do to get rid of that pain. If you're someone who's a little bit more ready to get the help that you need to get rid of it, then there's different options on that website too. In the meantime, if you like this video, please click like and hit the subscribe button so you can get more information that we're going to be putting out here at Hands-On Therapy Services. Thank you.